Well, it's day 3 of the World Economic Forum in Davos, Switzerland. Team South Africa continues its call for investment. Meanwhile, world leaders, including Rwanda's Paul Kagame and Japan's Shinzo Abe, have addressed the meeting centered around the theme Globalization 4.0. Our anchor, Nzinga Qunta, is in Davos for us. Let's go to her now. Good afternoon, Nzinga. I hope you're keeping warm where you are. What interesting discussions are being had in Davos, and is Team South Africa gaining traction in its bid for foreign direct investment?
A very good afternoon to you, Nompumelelo, and our viewers. Today in Davos, there's a focus on the future of finance. There's also a discussion about how digital technology is going to work to be more inclusive. Of course, this is continuing the theme of Davos 2019, which is Globalization 4.0, shaping the architecture in the age of the fourth industrial revolution. So all those conversations around digital technology, the fourth industrial revolution, and how it can be more inclusive, how it can be more sustainable, how it can be more human focused. There are discussions taking place in the Congress Center. As you'll know, Nompumelelo, it's not just focused on one place when you're in Davos. There's discussions and events happening all over the little snowy, small Swiss town. Earlier on today, President Cyril Ramaphosa, ABSA CEO Maria Ramos, the founder of Discovery, Adrian Gore, the vice president of IBM, as well as the chairman of the JSE, and Dr. Rob Davies, our Minister of Trade and Industry, had a sit-down discussion, a breakfast investment seminar for people who are interested or thinking about investing in South Africa. That's continuing their push for 1.2 or 1.4 trillion rand over the next 5 years. We know that last year, of course, there was a job summit and the investment summit where 290 billion rand was pledged there. President Ramaphosa and his ministers coming out and continuing to push for that, continuing to say South Africa is a good investment destination. But as Finance Minister Tito Mboweni told us yesterday, they're not here specifically to sign deals. They're here to get some knowledge, to interact with the different people who are here, get ideas. And if a deal comes from that, that's fine. But they're not actively here sitting, signing agreements. Someone who you wouldn't perhaps associate with a conference that deals a lot with the economy is Dr. Motsoaledi, who's our Minister of Health. He joins me now. Minister, thanks so much for your time on SABC News. I thought it was so interesting that you were telling us last week what you achieved at Davos and the conversations that you started and that helped South Africa in the end. Talk to us about that.
Yes, good day, Nzinga, and good day to the viewers out there. Yes, your statement is what I repeated last week as a common mistake that is being done. Has got nothing to do with Davos. Because here in Davos we are talking economics, we are talking the economy, we are talking the GDP, we are talking growth, and they believe health has got nothing to do with that. There has been a realization by the world that actually health and economic growth are inextricably bound. No country can successfully grow their economy with sick people or with people who are not healthy and unproductive. And unfortunately, this realization, I must state, came because of a disaster, that happened in West Africa in 2014 during the advent of Ebola. The economy of Sierra Leone in 2014 was growing at 14%. That's quite phenomenal, even though you may say it was starting from a low base, but it's phenomenal for any economy to grow at 14%. It took 9 months of Ebola, a virus, a disease. It took just 9 months to move that economy into. It might take many years to bring it back to where it was. The world started opening its eyes that, by the way, we can sit together with all the skills and the experts in the world, put up economic models, but one small disease process can scoop at that. And so they realize ministers of health have to be part and parcel of Davos, so that as we talk about growing economies, we also talk about how to improve economic systems and how to invest in them. In the final analysis, a realization is done that healthcare expenditure should not be classified as expenditure, but an investment for the future and the economy.
Talk to us about the discussions that you've had so far with potential people that you'll collaborate with in Davos.
Well, we're collaborating with many ministries of health. We're collaborating with private sector institutions. But the central issue that is being discussed here in Davos now is universal health coverage. If health and economic growth are inextricably bound, And if economies cannot grow without good healthcare system, then it means every citizen on this planet must be given access to good quality healthcare, regardless of their socio-economic conditions, regardless of their income. In the same way as if you need skills, training and skills and education to grow economies, then you have got to provide education, regardless of economic status. So that's what is being discussed. And actually what has been concluded is that in September this year, there must be a high-level meeting at United Nations where heads of state must be given this topic of universal health coverage to debate, meaning what? That citizens around the world have got right to access to good quality, affordable health care, regardless of their ability to pay or not. So that's exactly what is being discussed, and it's a central issue. But then when you do that, if you must provide good health care to all citizens, you need a lot of innovation. You need a lot of investment in healthcare, and so that is part of the mix.
Minister, earlier on, I saw you attending that investment breakfast there. Adrian Gore was there, CEO of Discovery. Did you have any chats with him about NHI and how you can collaborate on that, maybe?
Well, not now, but we discuss, even at home, we discuss, because I think there's realization from everybody that there's no way that they can wish away universal health coverage. I told you, it's now going to the heads of states that every president, every prime minister, every head of state around the world is going to be discussing. So we are discussing how to do it. Coincidentally, the last session I've attended was about bringing public and... You know what I told them? I said in South Africa, it's no longer a debate of whether public and private must work together in NHI. It's no longer a debate. The issue is how. That's what we are discussing now in South Africa. How are we going to do it?
Thanks so much for your time, Minister. We have to go back to studio. We're going to continue giving you updates on what's happening in Davos. We've also got an amazing story of a South African living here who sells rooibos in Switzerland. So it's back to you in studio for now. Nompumelelo and Arabile.